4 weeks ago today, Kamala Harris was sworn in as vice president, the first woman and the first person of color to hold that post. And she and President Biden are facing a country in crisis this morning. Nearly 500,000 Americans dead from COVID-19, a struggling economy, and unprecedented division in this country. And Madam Vice President, a lot on your plate. With that, good morning. I say thank you for making time for us. It's good to have you with us.
Good to be with you, Savannah. Thank you.
Well, let's get started right there. We are in a race to get people vaccinated as these new strains of COVID-19 are coming into this country. A lot of folks are watching say, I can't get my parents a vaccine right now. I can't get a vaccine appointment. States have said they're ready. They've got the infrastructure to give shots, but they don't have the supply. Governors even wrote the White House, Republicans and Democrats, saying we need better coordination from the federal government. So this is on your watch now. What's the holdup? What's the bottleneck, and what's being done about it?
Let's talk about that. But first, Savannah, I just want to mention all of those folks in Texas and the Mid-Atlantic. I know they can't see us right now because they're without electricity. But the president and I are thinking of them and really hope that we can do everything that is possible through the signing of the emergency orders to get federal relief to support them. So just want to mention that.
Thanks.
But yes, so vaccines. So here's the thing. First of all, we have a vaccine now, and that is great, but we need to get it in the arms of all Americans. And as the president said last night, we expect that that will be done in terms of having the available supply by the end of July. And so we are very excited about that, and we're excited about what we've been rolling out. You're right, we're 4 weeks in as an administration, but we have during these 4 weeks done a lot that is about a national protocol for getting the vaccines to folks, supporting the states who needed that kind of coordination and support. We have a whole program that now is that we've rolled out, getting 1 million vaccines to pharmacies. We are getting vaccines to community health centers, very important to supplement what the states are doing. We want to make sure that we get it directly into communities. And then 13.5 million a week going out. As quickly as we're producing it, we're getting it out.
Let's talk about...
And we just want to say to everybody, just please get vaccinated. And in the interim, let's do what we know we can do and is within each of our ability to do, which is in the interim, wear a mask, social distance, and make sure you wash your hands and do that frequently.
Let's talk about schools. We got a lot of parents watching right now, maybe with their kids right next to them because they're not going to school. The CDC a few days ago finally put out some long-awaited guidance on how schools could safely reopen. But here's the thing. They tied it directly to the rate of infection in any given community. And I'm going to put a map up because if schools were to follow that right now, 90% of the counties, 90% of the schools would not be able to open under the CDC's own metric. Was it a mistake for the CDC to connect school reopening to how much infection there is in a community?
Well, let's first say this, that in the last 4 weeks, schools are opening every week. More schools are opening. And it is because we are supplementing what needs to happen around the vaccinations getting into to states, but also because we're seeing progress. When folks are wearing masks, when they're getting vaccinated, when they're social distancing, we're seeing progress there. But we all want the schools to reopen, Savannah. All of us who have children in our lives, they want to go back to school. We want them to go back to school. Teachers want to teach.
But what about that CDC guidance then? That's the question, because the CDC is saying essentially their best guidance is don't open if you're in a red zone. 90% of students are in a red zone. And the science is very clear. The CDC's own science says schools are not a source of community risk.
Well, so here's the thing. What the CDC, what they have recommended are exactly that, recommendations about how to reopen safely if they've been closed, how to stay open if they've been opened. And so the recommendations include what, again, needs to happen around social distancing, hand washing, mask wearing. But the point is that we all want our kids to get back to school as quickly as possible and as safely as possible.
There has been a shifting timeline here. Back on December 8th, the then president-elect tweeted, we want to reopen the majority of schools in the first 100 days. He later said that day, we want to have most schools open. Now he said as recently as last night, he's talking about the majority of K through 8 schools. Last week, we heard a White House official saying open means it could mean just 1 day a week open. The president said, no, that was a miscommunication. But I mean, I guess, look, again, parents watching, what is the bottom line? What does it mean for schools to be reopened, and how soon can they be reopened?
So our goal is that as many K-8 schools as possible will reopen within the first 100 days. Our goal is that it will be 5 days a week, and so we have to work to achieve that goal. But our goal is the goal of parents. And I mean, here's the thing, Savannah, I don't need to tell you. We are the issue here is not just about statistics. It's about our kids. It's about their parents. It's about the fact that every day our kids are missing essential, critical days in their educational development. You know, we know, we have worked on this issue for years around the fact that, you know, by the end of third grade, if a child is not at third grade reading level, they literally drop off. So each day in the life of a child is a very long time.
Absolutely.
And that's why, right, and that's why we've got to collectively do everything in our power to reopen our schools as quickly as possible and as safely as possible.
A lot of public health officials will say this closing of schools is as much of a public health crisis for all the reasons you mentioned. A final point on this before we move on. You know, the CDC has said it is not a prerequisite for teachers to be vaccinated for them to go back to school. But many teachers are wary of going back to school. And we've had some cities have to sue the teachers union or sue their own school districts to try to get these schools to reopen. Can you reassure teachers who are listening right now that it is safe for them to go back to school, even if they are not vaccinated, if these public health measures like distancing and masks are being implemented?
So first of all, let me just say this, and the president has said it, and we're all really clear. Teachers should be a priority. Teachers should be a priority. Look, let me just tell you something. I love teachers. My first grade teacher, Mrs. Frances Wilson, attended my law school graduation. Teachers are critical to our children's development. They should be able to teach in a safe place and expand the minds and the opportunities of our children. So teachers should be a priority along with other frontline workers, and we're going to make them a priority. I believe that up to 22 states, I believe, have prioritized teachers in terms of vaccinations.
But if they're not vaccinated, is it safe for them?
Well, I think that we have to decide if we can put in place safe measures. This is why, and it's so important, we pass the American Rescue Plan. The American Rescue Plan, which the President and I have proposed, is a plan that is about getting our schools back open. Why does this connect with what we're talking about right now? It's going to be safer for our schools to reopen when we can get our schools the infrastructure needs, like helping them with their ventilation systems, helping them create social distancing with barriers, the things that are necessary to get them back open in a safe way.
I don't want to beat it to death, but I know there are teachers listening, and the CDC has said they don't have to be vaccinated to go back to school. Of course, it's the priority.
We think they should be a priority.
Okay.
We think they should be a priority, and the states are making decisions individually about where they will be on the list of who gets vaccinated. I believe they should be a priority. The president believes they should be a priority.
Let's talk about this COVID relief plan, $1.9 trillion. You're on to talk about it today. It's a big, big price tag. There's already been $900 billion just passed a couple of months ago on top of the $2.2 trillion that was passed with the CARES Act last spring. A lot of economists say you got to go big in this environment with this much of a crisis. On the other hand, even some economists who are friendly, Larry Summers, for example, who was a top economic advisor to President Obama, has said we're going into uncharted territory here. You're talking about 10 to 15% of GDP. Is that top line price tag at all negotiable to you and the president?
Well, first of all, let's talk about the 2.5 million women who are out of the workforce since COVID started. Let's talk about the fact that 10 million people in America are unemployed, that people are in food lines for hours in America. Let's talk about the fact that we, this week, are probably going to hit 500,000 people who have died from this virus. So this is a big problem. I mean, the issue of 2.5 million women out of the workforce is a national emergency as far as I'm concerned. So a national emergency, a big problem, requires a big solution. And we have to talk about proportionality. You can talk about the dollar amount, but let's talk about the harm that is designed to address, to get people back up. So what does it do? It's about money to schools. It's about money for vaccinations and distribution. It's about getting money for people who are unemployed, helping them stay in their homes. This is what the American people right now need. And Savannah, I would say to you, Well, you know, we can talk about natural disasters like what is happening in Texas and the mid-Atlantic. And, you know, with the issue of COVID, it has been a disaster that is still going. You know, sometimes we talk about hurricanes and then what we need to do relief afterwards. This hurricane is still raging. We still have people dying on a daily basis, and we've got to address this. We've got to help our country heal and survive through this crisis so we can get back on our feet. And that's what the President and I and the American Rescue Plan is designed to address, an emergency that is occurring right now and is ongoing. We need to act, and we need to act now.
There's a lot more to talk about on this topic. Unfortunately, we're out of time, but I do have to ask you on the subject of impeachment. The president was acquitted in the Senate trial. Mitch McConnell, the Republican leader, though, had some pretty harsh words saying that he didn't get away with anything yet and that civil and criminal liability was still a possibility. I ask you, do you think that President Trump should be criminally charged?
You know, right now, Savannah, I'm focused on what we need to do to get relief to American families, and that is my highest priority. It's our administration's highest priority. It's our job. It's a job we were elected to do, and that's my focus.
But you're a former prosecutor, so I got to ask you, is that a strong case against the president, a criminal case that Mitch McConnell had raised as a possibility?
I haven't reviewed the case through the lens of being a prosecutor. I'm reviewing the case of COVID in America through the lens of being the Vice President of America.
Well, speaking of, and I really do got to let you go or they're going to cut off my satellite here. You're Vice President. You've been in the office for 4 weeks. What's the strangest thing or the most surprising thing that's happened so far?
Oh, that's a great question. Well, it's still something, you know, my husband and I look at each other and I say, you know, you're the second gentleman of the United States. And he says, you're the Vice President of the United States. And we both kind of smile and then we get back to work.
All right. Well, Madam Vice President, it is good to have your time this morning. Thank you for making time for us.
Great to be with you.
Thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.